So you have a 35-year-old female, right? And then admitted for um, either hypothyroid disease versus hyperthyroid. And so the nurse is teaching the new graduate how to distinguish between them. Instead of giving you a lecture or giving you too many information, I give you words and you connect, you do the puzzle. What do you think? You can label them and then you type them up. What do you guys think? I will start. Weight gain, you know, is hypothyroid, right? Weight gain. You're going to gain weight. Methimazole, where does it go? Methimazole, right, is to block thyroid hormones. So which one are we going to block thyroid hormones? Hyperthyroid, they have too many thyroid hormones. Artificial tears, think about it. Thalamus. So you got to dry their eyes. You find it in hyperthyroid. Who's going to need a lot of calorie? Is concept. Who need a bunch of calorie? 4,000 to 5,000 calorie a day. Hypothyroid patient who has gained weight does not need too much calorie anymore. It's hyperthyroid that usually burning all their fat they have to eat and they're not gaining weight, they're losing weight, will be hyperthyroid. Who has bradycardia? Hypothyroid, because everything is down except the weight. Who need a Lugo solution? Think about it. What is Lugo solution? It's iodine. Excessive iodine, potassium iodide, and it will block thyroid hormone. And therefore, we give it to hyperthyroid. Elevated TSH, if you have low level of thyroid hormones, your TSH go up. So that goes to hypothyroid. PTU and methimazole do the same thing. Therefore, test taking strategy, when we put methimazole under hyperthyroid, we have to put these two under hyperthyroid. Who need to avoid high fiber diet? This one, critical thinking. Who need to avoid high fiber diet? Think about it. Who should avoid high fiber diet? To be able to answer, ask yourself, what does high fiber does? High fiber, what does it do? And who need it? And who should avoid it? High fiber diet will give you diarrhea. No diarrhea, but it make your bowel move more often. Hyperthyroid patient, their bowel is already moving, so they have diarrhea. So hyperthyroid has diarrhea. They should avoid high fiber diet. They will have multiple bowel movement. So that one goes here like that. Hypothyroid has constipation, so they should take high fiber. The answer say avoid high fiber diet. You should go under hyperthyroid. And who need protein shakes? The person who need a bunch of calorie is the same patient who need protein shakes. And so that go under hyperthyroid. So maybe, let me see. Let's go to OB, 35-year-old female. Just had a baby. Okay, delivered. And then we want to know, she came back to the OB clinic. We want to know if she has postpartum blue. Okay, so blue, or she has depression. She have depression or psychosis. Okay, how do we know? What is the difference between them? Which one is the most common? The most common one is the blue. Now, which one? Okay, 2 weeks postpartum. Number two, where does it go? 2 weeks postpartum. Okay, 2 weeks postpartum. Usually psychosis. That's when you're okay. Which one will resolve in 2 weeks? Is usually blue. Blue will do that. Which one require inpatient treatment? Is psychosis. Psychosis needs to be admitted in the hospital and treated. Which one requires psychotherapy and medication? Is usually depression. Depression does not resolve in 2 weeks. It takes a while. It can take like a couple of months. Blue resolve within 2 weeks. And which one occur 4 to 6 weeks is depression. So you should master this table as much as you can. Okay, master this table as much as you can. Team of RN, UAP, and RPN, and they're taking care of a patient. So taking care of a patient, which assignment is appropriate, or which job you think one should do? What do you think? Of course, recording INO, it is the UAP job, right? How about the rest patient? Who's going to check the vitals the first 15 minutes of blood transfusion? Who's going to monitor the RN finding? Who's going to change stomach bag and check if the stomach is viable? Somebody say RN is going to admit, okay? Going to check 15 minutes of the blood transfusion, the vitals. UAP admin, RN admin patient 2, 3, and 4. So somebody say RN 2, 3, and 4. So look at the thing. You got to pay attention to test taking strategy. I said monitor RN finding. RN cannot monitor their own findings. Who is going to monitor things RN has found? It's going to be LPN. RN cannot monitor their own findings. It will give it to the LPN to monitor it. So number 4, go to LPN, right? LPN can change the stomach bag, right? By checking for variability, whether the stoma is viable, it has to be it's an assessment. So 6 is an assessment that is done by the RN. Okay, very short question, but it has a lot of stuff in it to teach you guys what to do. Okay, short question, but remember, checking the stoma viability is a assessment. So that is what your RN has to do that. 45-year-old male with ankle fracture after a fall with right leg pain. 23-year-old male, sudden onset of right testicular pain, elevation of the testicles. A 35-year-old male with cranial nerve 5, left cranial nerve 5 palsy with severe throbbing pain with chewing on the left side. And a 35-year-old male with myasthenia gravis with weakness at the end of the day. You have to be sharp. If you don't know how to do be sharp, check adapting. But who are you going to see if I give you these patients, made up patients? Who are you going to see? If you have 1 second, who is going to you're going to give this to? If you fall, it does not matter. You're going to have pain. I never say calf is tense. There's evidence of compartment. You're going to have pain after you fall. When your testicle sudden onset and elevation of the testicle. Okay, this is the scrotum with the testicles in it, right? If it's now elevated all the way here and you have pain, it's torsion, testicular torsion. You don't want to lose your limb. This pain is going to let you lose your limb, life limb eyesight. If you're going to lose your limb, the guy is not going to be happy with his testicles. Cranial nerve 5 palsy. This is trigeminal neuralgia, right? You're going to have severe pain when you chew. It's not a problem. You have myasthenia gravis, you're going to be tired at the end of the day. That's why you do your things in the morning before you get tired. Classic adapt NCLEX way, learning how to do these things. They don't need to be seen. So that's your priority there. Thank you for watching and good luck in your exams.